There are 4 valves in the heart. They all let blood come through and not go back from whence they came. If the blood goes back, then that's a leaky valve. The one we think of most with a leaky valve would be the aortic valve. The big heart pump throws blood to the rest of the body out the aortic valve. When it goes out the aortic valve, it goes to the rest of the body. It nourishes the body so that we can have all the energy that we need. But when the heart rests, that blood tries to come back. And there are 3 little cusps that keep the blood from going back from whence it came. If those cusps don't catch the blood coming back to the heart, that's a leaky heart valve. A leaky heart mitral valve is sometimes called mitral valve prolapse. Sometimes it's serious, sometimes it's not. The aortic valve, however, if it has a leaky valve, you have to constantly have that evaluated by your cardiologist. He will guide you as to how often you need to see him. Now there's 2 other valves, the tricuspid valve and the pulmonic valve. And it's the very same thing with those. If the blood goes through the valve when the heart beats, if it comes back, that can be dangerous. We usually don't have much problem with the tricuspid valve. With the pulmonic valve, that's the valve where blood goes to the lungs. If there's something wrong with the pulmonic valve, it's usually high blood pressure. High blood pressure in the lungs, and there are medicines that we can use to lower the blood pressure in the lungs, entirely different from the blood pressure in the rest of the body. Aortic valve, probably the one that's the most significant when we say the word leaky valve. That valve can be replaced. It can be replaced through a catheter. Absolutely amazing what the cardiac surgeons can do. So know that if you have a leaky valve, it's got to be followed. You've got to listen to your doctor, and he'll tell you if it's serious or not in your case and how often you need to have return visits.